Hi, the purpose of this video is to review the prevention of ACL or anterior cruciate ligament tears. Who is at risk of an ACL tear? Well, the short answer is effectively any athlete, whether young or old. However, there are certain risk factors based on your age and activity status that may place you at additional risk. Some of these risks include young age, including especially younger female athletes, or others that perform more contact, cutting and pivoting sports, particularly football, that comes with an inherent risk of contact and injury to the knee. There are other risk factors, including the more recreational, older athletes that have more infrequent athletic participation that are at risk of injury. For example, older skiers that may only be skiing once or twice a year. And furthermore, there are some patients that are at particularly high risk, especially those of whom that have previously sustained an injury to the anterior cruciate ligament. This video reviews some effective prevention strategies so as to predict and prevent injury to the knee as a result of strengthening and rehabilitative exercises. High-quality research also underscores the importance of a structured training program for the prevention of ACL tears, as high-quality research demonstrates a risk reduction up to 73% for patients at risk of ACL tear undergoing a strengthening and rehabilitative program. Generally, it is recommended that you pursue a training program that only takes 15 or 20 minutes per session, 2 to 3 times a week. This can be continued during the season or in the off season, and sometimes linked with different competitive sporting schedules, including things like practices or before games, or on the weekends or when you're going to the gym. Following this is a review of some of the general rehab and training exercises that can be useful to an athlete so as to prevent the risk of injury. The first category of ACL prevention training program includes neuromuscular control. The idea behind neuromuscular control is that great athletes have excellent control over their nervous systems. And the nervous system is the critical command and control structure that controls the muscles and allows them to activate in a controlled and coordinated fashion so as to prevent injury. Excellent athletes are able to have great balance where their muscles are actively coordinated, and this can be improved with exercises such as a single leg balance that is performed with a single leg standing on either a half ball or even on a foam pad for up to 30 to 60 seconds, and a variety of different tasks can be executed during the single leg balancing training. Other activities such as lateral hops can be performed over an object where careful landing and light loading of the knee during each land can be specifically trained so as to improve the coordination and strength of the knee. The second category of ACL tear prevention training is plyometrics. The concept of plyometrics is that when large loads are applied through the knee joint, it is most beneficial so as to prevent injury that these loads be applied over a short period of time, and that concept is known as power. The idea behind power is that very strong muscle activation, especially over a short time course, can be trained with things like tuck jumps, where the knees are brought to the chest in 10 to 15 repetitions each so as to improve the power through the knee. Other things like box jumps, where one jumps onto a box and then comes down on one leg and performs multiple repetitions of the same maneuver, can be quite helpful so as to train the power and the load that's transmitted through the knee joint under a short time course. The third category is strength training, and one can imagine that having strong muscles is a great way of dissipating loads through the deeper structures of the knee joint. Specifically around the knee, the hamstring muscles function to counteract the anterior tibial translation that is performed and that goes through the knee joint with different loads that are frequently seen by the ACL. These loads are dissipated by hamstring strengthening. A great way of improving hamstring strength is by an activity called a Nordic curl, where the knees are held on the floor and the ankles are stabilized either by a bar or by a partner, and the body is gradually lowered to the floor and then back up again with load that's sustained by the hamstrings. This is then repeated 6 to 8 times. Another great exercise that functions to strengthen the muscles of the quadriceps as well as the hamstrings, which are muscles on either side of the knee joint, includes squats or leg presses. And these exercises have an important stabilizing effect on the knee by strengthening muscles on either side of the joint. Generally, try not to overload the weight so that 10 to 12 repetitions can be performed, and repeat this over several sets. The fourth category of exercise includes agility and cutting technique. And the principle here is that by training the knee to forcefully offset the loads that are applied through the joint on quick changes in position and decelerations can help to avoid injury by preventing the knee by falling into valgus or an inward posture that can lead to injury. These exercises are particularly helpful to have a coach or a parent watch you so that your form can be scrutinized and your posture can be improved throughout the exercise. Shuttle runs are a great exercise to train yourself to stop and change positions forcefully by running 10 yards, stopping and quickly changing directions, and repeating this over 5 to 10 repetitions with attention paid towards keeping the knee above the foot so that the knee doesn't fall into an inward position or valgus posture during position change. Figure of 8 drills can be performed by placing cones 5 to 10 feet apart and running a figure of 8 with attention made towards keeping a low center of gravity, keeping the knee above the foot, and preventing inward or valgus collapse of the knee joint during changes in position. This can be repeated for 3 to 5 circuits. Another and often overlooked category of ACL tear prevention training includes core strengthening, with the idea that a strong core can help to prevent compensatory movements of the knee that can lead to injury. A plank with the arms in front in a bent posture is a great exercise to improve the core and abdominal and low back activation by holding the plank position for 30 to 60 seconds and repeating over several sets. A modification of a plank that is helpful for activation of the gluteal muscles include a side plank with a leg lift. The idea here is that from a side plank position, the top leg can be lifted approximately 10 times away from the ground and repeated approximately 10 times for a full set. This is a great way to activate not only the core, but also the gluteal muscles. The last category of ACL tear prevention training includes flexibility and dynamic stretching, which is a great way of conditioning the muscles and getting ready for competition, usually as a warm-up. Dynamic lunges are a great warm-up and a great way of improving the activation of the muscles in preparation for competition or practice. And these can be performed by stepping forward with attention to break your load with the front leg with the knee over the ankle and repeating this approximately 10 times. Leg swings are also a dynamic stretching activity that involves swinging one leg while holding the wall forward and backward forcefully approximately 10 to 15 times, which activate the hip and gluteal muscles and prepare the athlete for competition or practice. This is then repeated on the other side and can be performed over several sets. Throughout these exercises, it is critically important that attention be paid to form and mechanics so that the knee is maintained over the foot and the knee does not fall into a so-called valgus posture, which is a critical posture that can lead to injury of the knee joint. And therefore, it is often helpful to have a coach or a parent or a friend watching your form and commenting and giving you feedback to ensure that the muscle activation and the landing mechanics are sound. Thank you for your interest in ACL tear prevention training, and please review our website for more information.